Welcome to the second segment of our discussion about mental health in the firehouse. This is a series we're calling When the Smoke Clears. You'll remember in our first segment, the group talked about the status quo of mental health in the firehouse. We heard some of the challenges to firefighters asking for help and some examples of when people knew it was time to reach out. For this installment, we want to explore if real progress has been made on this topic. We want to know if things are improving, what else can be done, and what things are not working. We want to look for opportunities to engage with other solutions if needed, and discuss how the legislature has tried to address this growing concern. Finally, we want to know if firehouses today are having these important conversations, and if they are open to needed changes. Welcome back. Episode 2, we're going to discuss, has the firehouse gotten better about talking about mental health? And Troy, we kind of ended episode 1 with you discussing a little bit about making that initial call. But if you wouldn't mind sharing a little bit more about your situation and really what was the reaction to from other firefighters or leadership as you rolled that out, and then what support did you find once you started talking about it? So initially the reaction from everyone that I talked to, especially my fire chief, was just shock. And when I had called, Chief Abernathy was one of the first phone calls I made from IFD. He started me on a road of really a big help, him and Brandon and Tim. But they were the first things, which was so cool when I was just bawling my eyes out, was that they said, "I'm proud of you." All of them said, "I'm proud of you." And then they said, "I had no idea." So as firefighters, we're really good at wearing that persona. We're really good when we put that uniform on, that it's almost like a shield, if you will. That stuff may come in, but nothing comes out. And so it was really good that I got some help that way. And what I ended up doing is I ended up going to a place in Florida called Florida House Experience, and into a program that was for first responders, and it's called Shatterproof. And they were amazing. I have no words that they were just amazing. What was really awesome is that the administration was 100% supportive. I didn't think they would be. I didn't know where to turn when it all boiled over, and I had just given up, and so I just reached out for that phone. I was very happy to see that they were so supportive. They detailed me off, and they said, "I don't care what we have to do to get you better, but we're going to get you better." They said, "We'll worry about anything as far as discipline or whatever for some of the actions that I did with a lot of I did a lot of yelling. And I'll be honest, I drank a ton of alcohol, which is how that I numbed out everything, and nobody knew it because I was good at hiding it. I never did it on duty, but when I was off duty, I found really good ways to hide it, and I drank it all different hours of the day. I'm very proud to say that I haven't had a drink since December the 16th of 2020 was my last one. And I was, overall though, things got better. When I came back, everyone was supportive. I was really scared to leave, and I was really scared to come home. And when I came home, I was just very happy to see that people just came up and gave me a hug and said, "We're glad that you're here. We're glad you're not gone." And man, that meant the world to me. It did, still does. So yeah, it's gotten a lot better, and other people have gone to treatment. I've been blessed to be able to take people to treatment. so that then they don't have to go alone, which in the fire service, we don't crawl a hallway by ourselves. So why in the world would I let a buddy or sister go by themselves to a scary event? So stuff is a lot better.
Dr. Bob, in your experiences, what have some of your patients told you about getting over that hurdle of making that first call and some of the responses and support that they found?
Well, I think that Troy's experience is very common, and thanks for sharing that, Troy. I have had a lot of folks, go through the same program that he's gone through. I think making that step is something that our peer support teams really help with. Everybody that he mentioned is a member of peer support. We also have a number of folks who are open in their recovery from alcohol, especially. They jump in and help. So I think the answer to the helping the reluctance is outreach, education, just starting that conversation and then following it up with mentoring, as the marshal said, outreach, education, training. Our peer supports teams go out every quarter with outreach material. We train quarterly. They take that outreach material into the fire stations. Sometimes that's an article. Sometimes it's a little presentation that they can do for anyone that's interested. So, and they don't force themselves on anyone. They go in, and you'd be surprised at how many folks join around the table. So I hope that answered.
Yeah. And Tony, what is, we've heard a little bit of Troy's story and some others from what it takes to get over that hurdle. What are some additional things we need to be doing in firehouses?
Well, and taking a look back too, I think that, it was about a dozen years ago. I think I was a local president at the time. I called Dr. Bob and I said, look, I hear that you're working with some firefighters. I hear you're working with public safety people. I hear about this peer support thing. We need to do something. We've got a problem, and I want to see about how can we start addressing this problem. One of the ways, and Dr. Bob alluded to, is peer support. And I think that we took this on organically, I think, from when the script wasn't written. There was no book really to say, but we had people suffering. So I think we took it upon ourselves to first do what we could, bring firefighters together and say, how can we help one another? And Dr. Bob, you've played an instrumental role in that across this state, so know that. Then the next step was to engage others and say, this is, again, all hands working, to go to the administration and say, we've got a problem and we need to develop systems. We need to develop systems. Peer support was the first part. It gave our members the opportunity to know, well, there's somebody in my world that I can go talk to. The other thing that we, I think, recognize and are now working in this world is we identify that our people don't do well in Gen Pop, right? We do better when we're talking to people that have had the same experiences. We do better when we're inside of our own bubble. That's where we're most comfortable. So by developing peer support systems, but then developing our own programs, whether that's a intensive outpatient program specifically designed for the needs of public safety people, or an in-residence treatment facility, or something that where you went to seek help. We started to build those specifically for public safety because we realized that was the best way to get better outcomes, right? People that understood. So I think that where we're at today, I think we know where we need to go, and we're also engaged in many fire departments and their leadership we've gone shoulder to shoulder to say, we're going to develop programs, not just the peer support, we're going to take it a step further, and we're going to offer professional treatment outlets or professional programs to even just do a self-assessment and see where we are with our own behavioral health. Those are the things that we're doing, and even to the extent of developing the IFF Center of Excellence, an inpatient program that's dual diagnosis for addiction and dependency, but also a variety of behavioral health issues. Those are the things that we're doing that I think we can all be proud of today.
Steve, you and I kind of started off the same volunteer fire department back in the day, and certainly these were not discussions we had around the pool table or sitting around the kitchen table. But you've got over 3 decades in the fire service, and kind of what's been your experience growing up in the fire service, and now as you travel around the state, maybe what are some of the positive changes that you're seeing?
I think probably the biggest positive change is the brotherhood, understanding that everybody needs to be engaged at the administrative level to a jump seater on an engine on the interest of the people that we work with. I think we've all seen where pretty much people have had challenges and nobody reacted and just let it run its course, and they didn't have any support from their peers. And I think that has gone away. And I very much appreciate Troy sharing with us, because I think it's key is whenever somebody gets in that and they're ready to come back, is for everybody within the organization to let them know, we want you back. You're valuable to us, the organization. I very much appreciate that. That's what I think people need to see when they're trying to get in a better space, is that there is value in them and we want them back into the workforce. And I think it's important, and we're at a better spot to where we feel more responsibility to everybody within the organization as individuals.
Dr. Bob, we've done some new training for fire chiefs. We have a Fire Chiefs Academy for new fire chiefs out there. And if you could come and talk to them about the need for continued discussion, what would be some advice you would have for new fire chiefs, and to ensure that these conversations are happening in their departments?
Well, I think I'd start with, there's a lot of stuff out there, like what we're doing today, that doesn't need a budget, and it's just time. And I think that we're doing a great job with the stigma. But what our peer support folks and our union folks who kind of enable us, we see that it is, it's a little bit more than that, because when we get rid of the stigma, we have to have the system to put them in. There's a shortage in clinicians. One of the things that I did in my doctoral dissertation was about how do we get firefighters in the system and how do we do this right. Overwhelmingly, when I worked with the IAFF, firefighters want to talk to someone who understands their job. Huge. So again, there are a whole lot of things an administration can do, and a lot of them are doing. But I think maybe a structured approach to that would be helpful.
And we've talked about the peer support, but how can we ensure that goes kind of statewide? I think we have some pockets where it's really strong, and some models to look at, but maybe what are some next steps for us to expand that statewide from your perspectives?
I think many of our advocates, administrators, peer support, the local, even for volunteer firefighters, I think they can come and ask us, and we can bring them into the conversation. We just got another small combination department just this last week join us. But there's a lot of stuff that's, again, free, and we can, through stuff like this, we can direct people as to who to talk to.
I'm pretty blessed to be on the peer support team for the Local 416 with Dr. Bob, and he trains us really well. As starting as a volunteer firefighter as an 18-year-old kid, I'm still blessed to be on that same department up in a little town called Tipton, Indiana. And I asked some of our peer support leadership if I could give some of our resources to them and leave, like the stoplight, for example, picture of where they could scan some codes and get phone numbers of people right now. And I was excited to hear that our peer support leadership was like, yeah, absolutely. Absolutely. There's no difference between if you're a career firefighter or a volunteer. We do the same job. We're all family. And however we got to do to help each other, that's what we're going to do.
Well, that's going to be the end of our second segment of our mental health discussion. Join us next time on When the Smoke Clears, when we explore the programs that are out there when someone asks for help and is ready to take that first important step toward recovery. Until then, thanks for joining us. Stay healthy and safe.